Now we discuss with Dr. Daryl Turner the importance of thyroid health and how to improve and maintain it. Well, Daryl, welcome. You are from Arizona in a way, but you're actually from Napier, aren't you? What took a young man from Napier all those years ago in the 60s over to America to end up working as a leading specialist in thyroid health? What's been your journey?
Well, I was into research as a scientist, and what I discovered is that in the field of hormones, no one had solved the thyroid problem. In other words, many people, that is 80% of the population, actually have a thyroid condition, but they walk around under this category called subclinical hyperthyroidism. That is where they have the symptoms, but their blood tests appear to be normal, and they suffer for their entire lives. I decided to tackle the problems, solve it, so that a medical doctor can identify, dose, and titrate the patient to the right amount of medication.
That's a little bit like Ed Hillary saying, I decided to climb Mount Everest. That's a huge thing to tackle. Where did you begin, Daryl?
I began by researching all the different ways of identifying thyroid conditions, and I decided that reflexes and symptoms were the best way to do it. In fact, on my research, I came across a statement by a very famous doctor called Dr. A.J. Bayliss, head of the Endocrinology Society in England, head of the Lister Hospital, Department of Endocrinology, the endocrinologist of the Royal Family, and he stated to the Endocrinology Society a few years ago that none of the blood tests were accurate. That is, none. The only thing that was accurate was symptoms and reflexes.
So let's look at those. Let's look at those symptoms, because people at home watching might recognize some of what you say are the leading symptoms of thyroid imbalance or lack of health there. What sorts of symptom groups are you talking about?
Well, the main symptoms that you can easily identify, even when you look at a person, is where the weight distribution is, if they're tired and lethargic, do they have cold extremities like the tip of the nose, feet and hand are cold. In other words, are they wearing a jumper or a jersey when everyone is standing around in their shirts? And their general well-being. It affects the quality of their life.
What's the weight distribution that you mentioned? Could you elaborate?
Weight distribution happens around the middle. It's called the 3 spare tires. And quite often people are quite slim, but they still have these spare tires or even little tires around their middle.
So tell me where you took your research then. How did you start to solve all this puzzle of problems with the thyroid?
Well, I decided that the neurotransmitters, that's the brain, plays a major part. So I decided to measure the speed of the brain. I decided to measure accurately in the field of milliseconds, the speed of the reflexes, and I decided starting to gather what sort of symptoms people had, and of course it lowers the resting metabolic rate. That is why you have the weight gain around the middle. So I decided to measure the resting metabolic rate.
And what were your results with the patients with whom you were working, with your subjects on whom you were testing these things?
Well, I actually did clinical trials on 2,200 people over 3 years, and I collected all the data, and I employed a person who analyzes the data to actually come up with a formula that runs through my computerized system that actually tells you with 98.5% accuracy what's happening with the thyroid and how much dosage you need.
So this has been really scientifically tested on a wide group. It's been proven. You're finding good results. What's the uptake been in the medical profession, Daryl?
The uptake in the medical profession, let's just talk about United Arab Emirates, for instance. They have decided basically to make this a standard protocol for the entire country because it's a leading cause of diabetes, stroke, heart attack. The list goes on and on and on. The medical health systems, for instance, in the United Arab Emirates, cannot afford the 50% diabetic rate that they have. And they decided to do something about it. I was invited over there by the ruling family. I put all 121 members into treatment, with quite incredible and remarkable results. And now this is going to become standard protocol throughout the entire country.
So that raises the issue of the treatments for this. Once you identify and you know that there is a problem, what do you do to help this thyroid become much stronger and healthier?
Well, I actually have developed the medications and a range of medications to treat the thyroid, because you cannot treat the thyroid by itself. You've got to treat the adrenals, the iodine, the sleep. So you've got to treat all what we call the core hormones. So I developed a core hormone system that actually performs very well. By the way, during my clinical trials, I also developed a treatment for a thing called reverse T3, which is caused by stress. And of course, I'd also discovered how to put Hashimoto's into remission and how to cure it. And I also have the treatment protocol for Graves. These are autoimmune diseases that are associated with hypothyroidism.
This is sophisticated stuff for a young man from Napier. I'd like to bring John in here just to talk about what you're seeing in Global Health Clinic as far as thyroid problems in New Zealand.
Daryl, with the Thyroflex test that we've done, pretty much everybody's been underactive or hypothyroid. Does that correlate with the figures that you're dealing with?
Yes, yeah. In fact, the Broder Barnes and Terry Herdog, the number 1 and number 2 thyroid experts in the world, estimated in their book that it was about 80%. Yeah. We have found that it is about 80% in random trials, random testing, and in clinics like yours.
Thank you, Daryl. That's wonderful to get those links of the symptoms of thyroid, the heart issue that is a problem for many people in New Zealand. And I think we'll be following you through in future programs. Dr. Daryl Turner, thank you for your time today.
Thank you, Daryl. Nice to see you again.